You've checked out the website, you've done your search, you've looked at profiles, and you've found a therapist or therapists you're interested in and want to know a little bit more. Well, what's the next step? Well, the next step is the consultation, and that's what we're going to cover today. Hello and welcome. I'm Carol Cavelli, a licensed therapist, and I support the emotional health and wellness of women in midlife. And this video is part 3 of a 4-part series to help you find the right therapist for you. And in this video, I'm going to cover the consultation from both the therapist's point of view and the client's point of view, and what you should know and what you can do to help your consultation experience to better determine if a therapist is right for you. Let's get started. The first thing I want to say about consultations is just to give you a little overview. If you've gone on the therapist's website, and if you've seen that in my last video about determining objective information versus subjective information, a piece of the objective information is, does this therapist give consultations? And if so, is that consultation free? How long is that consultation? If they don't give a consultation, does that mean I have to commit to an initial session? Do I want to do that? So these are things you want to determine before you actually fill out either that form or email or call that therapist for the consultation. As a general rule, consultations typically last from about 15 minutes to even up to 40 minutes, depending on the therapist. So some therapists do give a session's length of a consultation for free. Typically, consultations land around anywhere between 15 minutes and a half hour. So I provide a half-hour consultation, but a lot of colleagues will offer a 15 to 20-minute consultation. So that should be on the therapist's website as well as part of that objective information. So based on that, you'll determine whether or not you want to move forward with contacting this therapist to see if this therapist is right for you. Moving into the consultation itself. So let's talk about the consultation from the therapist's point of view. So as you're going into the consultation, the therapist has a specific outline or criteria or certain pieces of information they want to find out to determine whether or not they're a good fit for you. And one of the first things that they're going to ask you is, what's happening? So now on the therapist's website, to contact them, they may have a form on that site that may say, like, message, please tell me a little bit about what's going on, or why are you seeking therapy now? And you could fill out that. So they may have a sentence or two of information that you've already provided. Sometimes that you can pre-book the consultation. So if you go on the website, it takes you directly to the therapist's booking page where you can schedule the consultation directly. Sometimes that's all you do, and then you're getting on the phone or you're doing a video chat with the therapist for a consultation. Sometimes after you schedule through their site, they'll send you a little bit of a form and then ask you why are you seeking therapy right now. So the different ways that consultations can be done is, kind of backing up for a second, is typically consultations are done over the phone, or more recently with video sessions and online therapy, there is consultations that are done over video. And so sometimes you don't have a choice. Sometimes the therapist does have the latitude to say whichever your preference is. Again, all this varies from therapist to therapist. So please make sure when you look at a therapist's site, you are knowing exactly what their consultation structure is. Jumping back to what I started this section with is the therapist wants to know what is happening. So whether they already have a little bit of information beforehand, or they're speaking to you for the first time, their first contact with you, they want to know why you why are you seeking therapy now? What is going on in your life? What is it that you need help with? And they're going to keep that a little bit brief because there's a limited amount of time in a consultation, and they want to make sure they touch on these several different things that they want to touch on. So try not to feel like a therapist is cutting you off. If you're going there with and you have like something very big going on, it, it's a delicate balance to take in and understand what is happening, as much as possible, but also keeping the time frame in mind. So all the other information that they need to find, including answering your questions, is done in that time. The next thing that they want to look at is a little bit about your history. So that could be, they could ask you some questions based on what you're seeking therapy about, what you've told them. They want to maybe have a couple of little, some pieces of information about certain things in the history of that problem. Sometimes they want to know if you've had therapy before. Well, typically we ask, did you have therapy? Have you had therapy in the past? How was your experience with therapy? Was it positive? Was it negative? Do you take any kind of medication, any kind of, generally in the consultation, it's geared towards psychiatric medication. If you move further, a therapist will say, do you take any other medication? We want to get a complete picture of your health and what you're being treated for. But in the consultation, it's typically, are you taking any kind of antidepressant, any kind of psychiatric medication? Is a psychiatrist prescribing that? Are you getting that from your primary provider? They may ask you the name of the person who's prescribing it. Typically, that information is requested if it is decided to move forward to an initial session. And another thing they're going to ask is in line is, have you ever had any hospitalizations related to anything psychiatric? If you've had more than one hospitalization. And they're going to ask if you have ever had a history. Well, if you have had hospitalizations, they'll ask a little bit about like what precipitated the hospitalization, what was the cause of the hospitalization, what led up to that. And they will also ask if you have currently or ever had any thoughts of harming yourself, harming other people, or have harmed yourself in the past in a way not to end your life. So they want to, again, get a better sense of the level of support you may need at this time, and whether or not they are the right person to provide that support to you, because their goal is to get you to the best level of care and to see if they're the best therapist, or that their skills can help you with what you're coming in with now. The next thing that a therapist will touch on are any significant policies that they have for their practice. This could be their availability. This could be what their cancellation policy is. Now, sometimes therapists do put this information on their website, and they will certainly provide you information about this if you decide to move forward. But from your end and their end, part of feeling that this person is a good fit is for both people to agree that the availability matches, so you can actually meet for sessions, and if the cancellation policy is something that can work for you. Every therapist has their own cancellation policy. There are some general rules or general policies out there, but each therapist has their own, and sometimes some are more nuanced than others. Again, that might be something you want to look for in that objective information on their site. Not all therapists put it on their site. So they may offer you that information during the consultation. If they don't, you definitely want to ask their availability and their cancellation policy, and I will go over that once we get to what you should be asking the therapist to find out if they're a good fit for you. The last thing a therapist will touch on during the consultation is how they work, like their style of practice, and they may provide some initial impressions based on the information that you've provided. So they may say, well, okay, based on what you've told me in this conversation and based on the information I have, this is what I'm seeing, and this is how I work, and this is the general approach I would take, just knowing what I know right now. Now, some therapists don't do this, or they do it in a more general way. Some therapists are a little more specific. It really depends on what they're hearing, how confident they feel that, okay, this person is someone that I can absolutely help. I have the skills to help them. This person is, within the scope of practice that I have, they're the perfect client for me. I know their problems, these kind of problems inside and out. This is what I address. So they may be a little more detailed in their impressions, or they may give a more general impression, or they may just cover how they work and see, how that is for you. But within that, and then I'll go over this in a moment, is you can agree or disagree with that. So I'm going to touch on that in a minute. In this part of the video, I'm now going to cover the consultation from the client's point of view, or the potential client's point of view, and the things that you want to make sure that you are aware of in order to determine if the therapist you're speaking with is the right therapist for you. Now let's look at the consultation from the client's point of view. So the therapist is asking you several questions, of which that I just covered before. And as they're asking these questions, it's so helpful if with each therapist that you're having a consultation with to take notes. Literally take a pen and paper and jot down the things that they're saying that stand out to you as important, whether it's a comment that they made about your situation, whether it's something about their policy, if they've mentioned that, if there's something in like, I'll say the vibe, if you have a sense that, wow, this really stood out to me. I think this person seems like they understand where I'm coming from. Or the opposite, like, I'm not sure, question mark, question mark. Start taking some notes, because if you are having consultations with multiple therapists, it would be so easy to start mixing them up, because essentially we all kind of ask and offer similar information. So you definitely don't want to be mixing up one therapist for another. So with that in mind, take some notes, jot down some impressions that are coming to you, and get a sense of how this therapist is relating to you and your situation. Does it sound like they have a level of confidence in helping you with your particular problem, or helping you to feel understood? Typically toward the end of a consultation, in the last few minutes, the therapist will, or I'll say should, ask, do you have any questions for me? I've asked you, what I usually say is, I've asked you a whole lot of questions. I gave you a whole lot of information right now. What questions do you have for me? How can I help you at this point, for you to determine if I'm the right therapist for you? And The questions you want to ask. So many questions will come up through the course of the conversation. So that's why you also want to take notes, because if there's certain questions that you want to review with the therapist, again, something they said or something that just pops in your mind, like, oh wait, I kind of want to know if this therapist mentioned this. I kind of want to know, do they, do they know about this? Can they use this to help me? Or again, anything specific to what's happening in the conversation. But you want to bring into the conversation a few questions that will help you determine before you make this initial appointment, before you pay either your copay or pay their fee and sit down with them for an hour and then realize, oh my gosh, this isn't going to work for me. You want to have these certain questions. Again, you can have them right next to you and you can just answer them, jot down their answer, write down their answer. But it's important to have these basic questions answered. And the first one is, what are your hours? Right? Do you work at times that I'm available? Some people are only available in the morning. Some people are only available in the evening. Before you even get to the nitty gritty, you want to know, does my availability match yours? Because if not, then we're wasting our time here, right? So you want to know, are they available at times that can work for you? The next thing you want to know is if you are using your insurance or need to use your insurance, and either going out of network or paying privately is not an option for you, you want to know if they accept your insurance. Now, that information, for the most part, you can find on a therapist's website. So again, that objective information, a lot of times it's in the FAQ section if they have one, or they'll have a section called fees and insurances, and it will state what insurances they accept, if they accept insurance, or if they don't accept insurance, what their private pay fee is, if they provide super bills for out-of-network submissions, so you could potentially maybe get a little bit of a refund or get it applied to your deductible, at least part of it. So I would say before you even get on the consultation and you want to determine if this therapist accepts your insurance, try to find out that information before you call, because it can be a frustrating experience for everybody involved, where the therapist is feeling excited, like, yes, I can help you. Wow, you're a great fit for my practice. And then hearing, being asked, well, do you accept my insurance? This is my insurance. And then the therapist's like, oh, I'm not in network with insurance. Can you pay privately? And then it becomes uncomfortable for everybody involved to determine if this could even work out. And then you end up feeling disappointed that this therapist can't help you. It's not typically a good idea to assume if a therapist is private pay or does not accept insurance that they're going to what's called slide their fee, a sliding scale, or discount their fee. If it's not on their site, then assume that they don't, because it becomes, again, a very uncomfortable conversation for everyone involved when a therapist is feeling excited about working with you, you're feeling excited about working with them, and then it's like, okay, well, your fee is this, and do you think you can discount that? Do you think you can slide on that? And if that's not part of the therapist's policy, then it becomes an uncomfortable conversation, again, for everybody. So if you can find out if that therapist is on your insurance prior to even having the consultation, whether it's through their website or whether through your insurance provider, then I would encourage you to do that first. The next thing you want to determine is, does this therapist work in person, online, both? Do they do video sessions, or are they just in person? And this comes down to your preference, If you're a person that wants your therapist, you want to see that therapist in person, you want to go to an office, you want to just sit, across from them face to face, then you want to make sure that that is what that therapist offers. Again, this is typically found on a therapist's website. If it's not clear on the website, or you want to confirm that they have in person, or you want to confirm that they have online therapy or virtual therapy, then confirm that in the consultation. The next thing you want to confirm, and again, this may not be on the website, some therapists have it, some therapists don't. You want to confirm what the therapist's cancellation policy is. Because as I said before, the cancellation policies can be all over the place. And everybody has a different cancellation policy, and it's just determining if that's right for you. Some therapists have 24 hours, some have 48 hours, some have up to a week. You have to let them know before that you're canceling. Some therapists have a no cancellation policy, which is similar to what I have, which is a consistency policy, that they allow cancellation up to a certain time, whether it's 24 hours before. For me, it's up to the time of session. Granted, if that session is going to be made up either the week before or the week after the session, and they're not charged a fee, and then there's the continuation of the care, and we just move forward from there. And there's other nuances to those kinds of policies, but you want to know what this person's cancellation policy is, and if that's going to fit within your life. Sometimes a 48 or 72 hour cancellation policy might not fit for you, especially if you still have like young children, children get sick, or if you're caring for a parent, and that parent has doctor's appointments you have to go to, or if they have health issues that they see doctors frequently, or they have unexpected doctor's appointments, and that might not fit within your lifestyle. So you definitely want to find out what their cancellation policy is and what that means. So if you're canceling within their policy, if they have a 24-hour cancellation policy, and you're canceling at the 23rd hour, what does it mean? Are you charged full fee for the session? Are you charged partially for the session? What happens if it happens multiple times? Like you want to know the cancellation policy. You will have an idea of that. They will give you the cancellation policy if you decide to move forward. There will be a document within your welcome packet that will say the cancellation policy. But if that's something that you're concerned about, then, and even if you're not typically concerned about, you want to find out what that policy is. The next thing you want to confirm is how the therapist works. And sometimes the therapist will tell you how they work, but you want to confirm how they work and if they can work with the problem that you're presenting them. You want to confirm that if they haven't confirmed that with you already. And tied in with that is, what are their impressions of what you're telling them in terms of the information that you've provided so far? So as I said before, a therapist will generally give an impression toward the end of the consultation, but if for some reason they don't, you can ask. Just say, hey, based on what I've provided you so far, based on what I've said, what are your thoughts? How would you work with me? What are your thoughts about what I'm telling you here? Is this something that you work with? Is this something that you're comfortable working with? And any other kind of questions related to that. So questions I typically get around, if someone presents me, they have an issue with anxiety or a past trauma, and they're going through perimenopause, I'll speak of, okay, my impressions are, and then I'll talk about how I would potentially address the issue, the anxiety or the trauma. And then they can follow up and say, okay, wow, that sounds great. Do you work with people in perimenopause? Do you understand what's happening in this aspect of my life? And then I say, yes, that is my specialization. And then we can talk about that. So you want to make sure that you get that general impression and that it dovetails with what you're looking for. If in the consultation you have questions about the therapist's training and whether that training can help with the problem that you're going to see a therapist for, ask them about their training. Or if you're presenting them with an issue, let's say such as couples therapy, you're looking for a couples therapist and you want to know, well, what kind of training have you had in couples therapy? And you can absolutely ask them about these more specific kind of trainings, and to confirm if they have it on their site, you can ask a little bit about the training that they've had and how that training would be relevant to them or different to them versus maybe someone who hasn't had that training, like how that training can help with your situation or problem. And finally, the last thing you want to just take into account once you get off the call, or once you get off the video call or the phone call, is to even jot down like what your overall feeling is, what's your overall vibe, what's your overall take on the situation, what's your overall take on this therapist. Like, yeah, this therapist, we seem to talk pretty well, or I just didn't quite feel comfortable with this therapist. So take about 2 or 3 minutes, and you can, like I said, you can write it down. You can make open up a document and just note that what your impressions were of the conversation, of the therapist, of their training, of anything that stood out to you, and just even of your overall feelings, like, yeah, this is a therapist I can definitely feel comfortable with, or I'm not sure, let me see who else I talk to, and then I'll get back to this therapist. So you have something to refer to later, because again, if you're speaking to multiple therapists, then you want to have some kind of separation between each person, because it can become all muddled. And again, one last thing with that is, don't feel obligated to schedule the first session if you don't quite feel ready. Sometimes it feels like a great fit, like, yes, this person gets me, this person understands me, I'm ready to go forward and have a session with this therapist, and then definitely see like this therapist is for me. You might feel ambivalent, I'm not exactly sure, trying to work it out, or you may have like 4 or 5 therapist consultations lined up and you don't necessarily want to go with the first person that you meet. You want to see what the other therapists have to say. So don't feel obligated to schedule that session, and you shouldn't feel like you're being given a hard sell. Now, most therapists aren't really into the hard sell. So I know, like, when I have a consultation with someone, I always ask them if they'd like to schedule, and always say, there's no obligation. If you want to think about it, you can get back to me, that type of thing. So always feel like you have that option to step out of the consultation, get your bearings, think about everything that you've talked about, or have follow-up consultations with other therapists and see what they have to say, and then determine which therapist is the right fit for you. I hope you found this part 3 of the 4-part series of helping you to find a therapist helpful. So this video focused on the consultation. The next video will focus on the first session. So let's say you decided, I'm going to meet with this therapist. The next video will help you understand what happens in the first session and what you might want to find out during that session for yourself, in order to really ensure that, yes, I want to go beyond the next session or this first session with this therapist. And if you liked what you heard, or you feel that it can value someone, please like, share. If you're interested in the videos that I put out, please subscribe. Please comment and let me know if there's anything you'd like me to talk about. And if you're interested in working with me, my information will be in the description. Again, thank you so much, and I look forward to seeing you in the next one.